Good evening, everyone. Welcome you to Ayur Samskritam Dvitiya. Myself, Dr. Janapriya, and in today's class, we'll start with a new subject called Swastavritta. As you know, Ayurveda, the science which mainly aims in attaining health and also curing ill diseases, right? So the main aim being प्रयोजनं च अस्य स्वास्थ्यस्य स्वास्थ्यरक्षणम् आतुरस्य विकारप्रशमनम्. So in the previous classes we have read about Charaka Samhita and the Vikara has been dealt previously. And today in Swastavrita we'll emphasize the importance of maintenance of health and what is health and how to lead a healthy lifestyle in order to have a healthy life and a long life. So moving on to the word Swastavritta, it means Swastasya Bhavaha Swastya. So any feeling or state of well-being or having good health, that itself is called as Swastya. The state is called Swastya. The healthier state is called Swastya. And in Chakrapani, Charaka Samhita, he is also commenting सुष्टुः निर्विकारत्वेन अवतिष्ठति इति स्वस्थः. So the condition where the body is devoid of any vikara, then the state is known as a healthy or swastha, or a person who is devoid, body is devoid of any abnormalities is called swastha. So when we see, the main aim of Ayurveda is to attain dharma, artha, kama and also moksha, and all of these can be achieved only by having health, good health, right? And he also comments on stating how the state of normalcy in the sharira or in the body can be attained by doing certain, following certain regimens in order to avoid having any diseases. Moving on, it says Swasthavritta, the definition can be stated as Swasmin sthane, Swasmin karmani, Swasu rupe stiyate, Tadvrittam Swastavrittam. So he says the normal condition where the doshas are in normal state in its own sthana. In swasthana, the normalcy is maintained by the doshas, and swasmin karmaha, that is their functioning of the doshas in its own side, with having normal functioning of doshas. Not only doshas here, you can take it as the dhatus and malas as well. When there is a proper functioning of all of these, and then it is called as swastha. And on how all of these are done, that is the achara or the vichara, on how the achara, the regimens which are to be followed to maintain is completely dealt. That is why it is called swastha vrata. And why do we need to read this certain topics on how we're going to understand, is because you see Acharya Sharangadara states any organism that has taken birth in the universe has to die, right? It is impossible to prevent it. Similarly, any person, any organism is inevitably is going to die and possibly can prevent a disease. So, whichever reasons or steps to be taken care to prevent a disease has to be the first step one should be very low, sorry, and a wise person who should perform certain activities and actions that are good for his body should be done, should be taken care of. Okay, and this body is very important to maintain the health in order to achieve all the other purusharthas. Okay? And moving on with the definition of health, that is samadosha samagnischa samadhatu malakriyah प्रसन्नात्मेन्द्रियमनाः स्वस्थ इत्यभिधीयते. This is the definition, and it is a very important shloka to understand, where he says samadoshaha, a person who has the state of swastha is defined when the person has samadoshaha, there is equilibrium of dosha, sama agni, where the agni is sama. It should not be manda also, it should not be vishama also, it should not be ati also. It should be in the state of sama. Hence, he says samadhatu malakriyaha. When there is a state of equilibrium among the dhatus and also with the mala, the proper evacuation of all the malas, and along with that, he is also mentioning about the manasika reason also here, the state of the prasannata of indriya, manas, and also the atma. So when there is the equilibrium in both sharirika and also in the manasika, then there is swasthata is seen individual. So that feeling of that state is called swasthya. Okay, and this equilibrium of doshas and the variations of the doshas which can happen basically are basically because of these factors. That is food. Food, as we know, the sharira is also made up of panchamahabhuta, and the ahara is also panchamahabhuta, and everything in this existence is because of the panchamahabhuta. So the ahara, whatever the ahara which is being consumed, is either going to nourish or bring about changes in the sharir. So ahara is the first thing which has to be taken care of. Next one is the vihara. Viharas are nothing but the activities, either it the activity is done by the individual or as in a community to maintain health, or also as the vihara that happens externally, also internally as well. Okay, so the state of where there is changes, abnormalities, that changes happens from the outside also and also from the inside, also comes under vihara. So Acharya Kashyapa also elaborates on how a person who is healthy will be seen for. Okay, he says a person who continuously has a desire of intake of food at proper time and also consumes proper quantity, and the food gets easily digested, and also the mala which is easily excreted at proper time, then one who follows all the regimens which has been told, then the swasthata can be attained. Okay, moving on, the rutu shodhana, the purification of the body that has to be done according to the rutus in the whole year for the body is also equally important in maintaining the swasthyata in the sharir. Moving on, in today's class we'll be dealing in detail about dinacharya. The daily regimens which has to be followed one after the other in the everyday. So the word dinacharya has two words, that is dina, that is day, or which should be followed in the everyday. Charya means any regimen, that is achara, any achara which you follow every day, that is charya, that is the regimen. So he says dine dine charya dinacharya, so which you follow every day is called dinacharya. What do you get from this? Once this achara is followed, you get ayu labhyate. So the lifespan is prolongated. So because of the normalcy of the doshas, etc., the lifespan of a person will be increased. Okay, and these regimens is mainly indicated for maintenance of hygiene, the way of hygiene, to bring the strengthening the body, to promote peace of mind, to enrich the indriyas, and to have a healthy long life. Okay, so this regimen starts from waking up till one goes to the bed. So the whole dina charya has been will be dealing now. Okay, so first one is or prataruthana, that is waking up in the morning. Waking up in the morning, when is the time? It is Brahme Muhurte Uttishto Swasto Rakshartam Ayushaha. A person who wants a long life, healthy long life, should get up in Brahmi Muhurta. Brahmi Muhurta is nothing but the 14th Muhurta of the day. Okay, so each day and night comprises of 15 Muhurtas. That is, one Muhurta approximately is 48 minutes. So this continuously 48 minutes of a 15 muhurtas of a day and night are equally good. So together in Ahoratri, that is in a day and night, that is one Ahoratri, there are 30 muhurtas. So in the night, when the night is completed and the day is going to start. So in that, the 14th muhurta, the last two muhurtas, the Dvigatika Kala is considered as Brahmi Muhurta. That is approximately before the sunrise. Okay. So a person should wake up at this Brahmi Muhurta. So that is, it also says that is Ratirupayantyo Muhurto Brahma. So the last, when the Ratri ends, that is when the Brahmi Muhurta is told. Okay. So why this Brahmi Muhurta? That is, in this time, the time which is ideal to learn or to have the knowledge to attain the Brahmatva. That is why this is called Brahmi Muhurta. And this, the last part of the night prior to sunrise is called Brahmi Muhurta. Okay. So a person has to wake up in Brahmi Muhurta. Moving on, the application of each one will be dealt in the next coming classes. Okay. So moving on to the next one, as soon as a person wakes up, a person after getting up should do Malotsarga, and Shaucha Vidhi has to be followed. That is, as soon as you wake up, you have to analyze that if the previously consumed food is digested or not. So if the previously consumed food is not digested and you still feel heaviness in your head, you feel bloated in the morning as soon as you wake up, there is a rule which is being told, that is, you can sleep again for another 20 minutes or half an hour, so that the previously digested food the food will be digested, and then you can wake up. Then do Shauchavidhi. So what happens is, that is, once as soon as you get up, you should sit facing either north or eastern direction. Take a sip of water, and after cleaning the areas, and then you can proceed for the next one. And also, once you are in the procedure, you should keep silence. You should not speak, and you have to concentrate on the complete evacuation of stool and urine. And also, in the morning, if there is urge as soon as you wake up or before you wake up, you should not control it. You should not be suppressing the motion or the urine. Okay. And then you have to wash the area properly, and also wash the hands and feet. Okay. And this is very important procedure to be done. And in the current times, there are most of the diseases are caused by this simple procedure, where a, a person takes too long sitting in the washrooms, and a lot of problems because of the suppression and the procedure, which takes very long time, are leading to a lot of apanavayu vikriti, and leading to different diseases. So it is very important to have a very calm mind, and to have a complete evacuation of stool or morning itself. And it should not be pressurized, and should not be done after consuming water or coffee or any other aids to induce the motion in the morning. Okay. So next one, after doing this, we go for Danta Davana, that is brushing. So one should brush in the morning, and also in the night, and also after intake of the food. So in olden days, the twigs were used. So the twigs of Arka, Vata, Kadira, Karanja, and Arjuna, or these are the drugs. The twigs of these should be taken, and these twigs, which should be of thickness of little finger, also the length should be of 12 angulas. So after taking the twig, and one should bite in with this, the tip of the twig, and these twigs of these dravyas are kashaya katutikta rasa pradhana dravyas, so that it will clean the area very properly. Okay? and and also the direction which has to be brushing, as is also being explained. Dantan purvamado garshanat prataha. So he says one should brush in a vertical position, that is purvam ado garshanat, from bottom to top, without injuring the gums. Okay, this is the best technique that is being explained. Even with the brushes which we have currently, one should brush in the vertical region from top to bottom without injuring the gums, so that the particles which is being present in between will also be removed. Okay? And this drugs, the twigs should have the mainly should have katu, tikta, and kashaya rasas. That is, bitter, astringent, pungent drugs should be taken. Other than all of the other drugs should be neglected, should not be taken. So these twig, which whenever they were collecting, they should be devoid of any knots or branches. And brushing brings about freshness and removes bad odors, and it brings down the kapha dosha in the mouth. So, and this Dantadhavana is contraindicated. A person should not brush if a person is suffering from vomiting, indigestion, fever, cough, and cold, and person has ulceration in the mouth, has heart diseases, or any other diseases of head, eye, or ear, should be avoid doing brushes in that point of time. So after you brush, Jihva Nirlekana, that is tongue cleaning is being mentioned. So this tongue cleaning should be done with the help of the instrument which is soft, smooth, and 10 angulas in length. So in olden days, silver, gold, or iron were being used, and these are the current instruments which we currently are being using. And tongue cleaning should be done to remove the daurgandhyata, that is the odor of the mouth, and stiffness of the tongue, and also it gives better taste. Okay, so after you do the tongue cleaning, one should do gandusha, that is gargling. So asancharyam tu matra gandushaha sa prakirtitaha tatta dravena gandushaha. So the liquid, any liquid that is kept in the mouth, asancharyaha, without movement in the mouth, when it is kept inside the mouth without any movement, that is gandusha. So you have to remember these words, that is asancharya, that is without any movement in the mouth. You keep it, that is gandusha. Okay. This is usually done with um, dravyas like honey, milk, oil, water, or meat soup, or rice gruel, or kashayas, which are to be kept in the mouth and done. And this mainly has different types. And whenever the liquid is kept in the mouth, only with the liquid this is done. Okay, and whenever the liquid is kept in the mouth, the doshas should get filled in, and or before the eye starts watering, and this gandusha should be kept. So after, once the doshas gets filled in the mouth, and if the person has watering of eyes, and then this should be spit out. Okay, there are different types of gandusha. That is snigdha gandusha, where the snigdha gandusha is given with sweet, sour, madura dravyas to elevate vata dosha. And in case of prasadhana, where bitter and shita dravyas have been given to bring down pitta dosha. And in case of shodhana, it is ushna and tikshna dravyas have been given to expel the kapha dosha. And ropana is especially given in the name of to heal the wound, that is to heal any wound. Kashaya, tikta kashaya rasas have been pradhana is being given for in the name of ropana. So having these substances, the liquid in the mouth brings about, improves the circulation in the oral cavity, and also it improves the swara bhala. The voice is improved, and also the crackling of lips is also reduced, and also decaying of tooth, and it brings about the strong strength in the gums. Okay, and any tingling sensation or any sensitivity, gandosha removes it. Okay, and there are lakshanas of proper improper gargling which is being also given. So based on the lakshanas, one can do the gandusha. And moving on to another type, that is kavala. Kavala is nothing but, you have to remember, that is sukam sancharyate. So in gandusha there is asancharya, there is no movement. In kavala there is movement. Sukam sancharyate, there is a quantity is less here. Ya matra sa kavala smrita. So the quantity which is being kept is less compared to the gandusha. And also sukam sancharyate, you can move the liquid around inside the mouth, is called the kavala. So again, Kavala is also again have the same, that is Snehika, Prasadika, and Shodhana and Ropana. The only difference between these two is the quantity and the movement of the mouth. Okay, this is Kavala and Gandosha. After Kavala and Gandosha, one should apply Anjana. Anjana is nothing but the colorium or the Anjana which we keep, the Kajal which we apply. These are of two types, that is Saviranjanam and Rasanjanam. So the Saviranjanam is when we apply is that it is Nityam and Hita, that you can apply every day, and this is made of the antimony, and this colorium can be applied every day, and the colorium sorry, the antimony versus rasanjanam, that you can be applied on either 5 days once or 8 days once at night only. This is main purpose of lacrimation, to bring about lacrimation, that is Savanartha purpose. Rasanjanam is being applied. So as we all know, the eyes are predominant of Tejo Mahabhuta, and there is a fear of afflicting with kapha. So, to bring down kapha, and the strong anjana should not be used in daytime, and as it can be weakened, and drainage can affect the eyes as well. And the method of application is being told, that is, one should hold the eye with the left hand, and the apply the anjana with the shalaka, that is Pangayam va yato yogam kuryachapi jatajatam. That is any the gatagatam, sorry, the using right hand, the shalaka, always apply from inner canthus to the outer canthus. Okay, so this application of anjana brings about clear vision, lightness, and proper functioning of the eyes, and it reduces the any diseases relating to eye. And one should not apply anjana in conditions of shrama and udavarta, and person who has cried, and after intake of alcohol, or if a person is continuously angry, or who is having fever, or also who has a redness, and there is excessive swelling in the eyes, anjana should be avoided. So after anjana, dhumapana is being explained. That is, dhumapana is to remove the excessive kapha in the shirobhaga. Okay, so shleshmaha shirastaha, right? So, sato pita matre dhume prashanti labate kshanena. So, the shiras is the main seat of kapha dosha, where to instantly reduce the kapha dosha, the smoking, the dhumapana is being prescribed or explained. So in this also there are different types, that is Prayogika, Vairechanika, Snaihika, Kasagna and Vamaniya, and these are done at different conditions and different time period also, and this mainly explains about inhalation and exhalation of medicated smoke. Okay, and this is also called as Dhumapana because Dhumam piyate iti Dhumapana. When whichever you drink or which you take in, that is why it is called as. And the method is, first you have to take smoke through the nostril and you have to leave it through the mouth. And one more method is you take through the mouth and you have to exhale it through the mouth only. Okay. If it is continuously taken out through nostril only, if inhaled and exhaled through nostril, then there will be problems with the vision. Okay. and this has to be taken after sitting with a comfortable posture, and either smeared with ghee or oil. You have to keep it inside the Dhumanetra, and the Dhumanetra is the instrument through which the smoke is coming out. This is the instrument which is being used for smoke. And when to be done this? That is, there are 10 kalas which is being told, that is, after taking bath, after eating, after you scrape the tongue, after sneezing, after brushing, after nasya, after applying anjana, and before going to sleep. So these are the time which is being explained. And also, once this Dhumapana is being done every day, it cures any heaviness in the head. See, every single day at present we've been seeing people, everyone has sinusitis, rhinitis, and a lot of issues with the headaches and dry eye and continuous dryness in the eyes and stiffness of neck and grayness of hair, and every all of these can be controlled by doing Dhumapana every day. So if improperly done, this could lead to deafness or blindness, and also diseases of Rakta Pitta can be seen. And moving on, then Nasya is being explained. Nasya is nothing but Nasikabhyam Diyate iti Nasya. Anything that is administered through nasal, that is nostrils, is called Nasya. Okay. Why this Nasya is very important is because Nasa is Sodvaram Tena Tad Vyapti Hantitan. So Nasa, the nostrils, serves as the door. It's the only opening that directly leads to the head. So nostrils is very important, and any diseases related to the head or neck can be cured, can be taken care with of the Nasya. Okay, and it is the only entryway for the head, and the nasal instillation cures the diseases of the head. And there are different types which have been explained, and when we see, there are different types, that is Nasya, Shirovirechana, Pratimarsha, Avapida, and Pradamana. So these are the different types, wherein the daily which you follow is Pratimarsha, the third one, that is Pratimarsha, where Pratimarsha is a type which doesn't have any complications, or which does not bring any complications. So what you do is, you just dip a drop of cotton or a little finger, and it should be instilled into the nostrils. So two drops, very small drops of 2 drops is being instilled in both the nostrils. So put 2 drops in one nostril, you inhale, and then put in another one. Okay, this can be administered at any time of the day. So that is why it's called Pratimarsha. And next one, this Pratimarshanasya, usually Anutaila is advised, and this can be done after sleep, after brushing, after if you're going out, or after exercise, after Maituna, after walking, after you passing stools, after you are evacuating the bladder, or after Kavala, after food, after the Vamana, or after in the evening, or after sleep in the day. So anytime Pratimarsha can be done. Okay. And Nasya and Shirovirechana, Avapidana, and Pradhamana are the types of Nasya which have been done in the state of the conditions related, diseases related to head and neck. And moving on to the next one is the Vyayama. Vyayama is nothing but Sharira Ayama Janam Karmam Vyayama Sangeetam. So any action, anything that produces tiredness to the body is called Vyayama. Any physical action is called Vyayama. So the definition goes as Sharira Cheshta Ya Cheshta Sthairyaartha Balavardhini Deham Vyayama Sankyata Matrayatam Samachare. So this is the definition of Vyayama, where the physical action, when done, increases Thairyata, that is the compactness, enhances the strength of the body. Stairyata and Balavardhini, it increases the Bala of the Sharira. And Deha Vyayama Sankyata Matraya Tam Samacharya. So when performed in the required amount, then it enhances the Bala of the Sharira. And it is also called Vyayamaha Stairyakaranam. So that is, exercise is the best the among every other ahara or vihara which promotes the strength or the bala in the sharira. So if proper exercise is being done, then there is the sweating and there is increased respiration rate. There is lagavatva. There is a lightness in the sharira and also increases the heartbeat. These are the exercises of proper lakshana of exercise. And it brings down the kapha dosha. It increases the agni in the sharira as well. Okay, and exercises one has to avoid doing in Vasanta Rutu, and also one should do mild exercise and prevent any body pain that follows after. Okay, and moving on, next one is the Abhyanga. Abhyanga is nothing but any movement which done towards the improvement of the dhatu is called abhyanga. So mainly in abhyanga, oil is applied to the skin and it directly nourishes the dhatus through the skin. So oil massage or application of oil is abhyanga, where this this is done mainly to reduce the vayu, the vata, which is also the main, about for the sparsha, the skin. And also abhyanga is very good for skin and it should be done every day. Okay, and so for abhyanga, any oil should be made lukewarm, and then according to the season and like the direction of the hair, abhyanga has to be done. Okay, and moving on, there are different matra kalas. The time duration has been mentioned up to 300 matra kala, that is up to 300 matra. Then it will reach romanta, and if it is done till 900 matra kala, it will reach till majja. That is the majja dhatu. So one every day, if a person is doing this abhyanga, it is very ideal and which will promote health. Okay, so what it does is abhyangam acharet nityam sa jara shrama vataha. So one a person who does abhyanga every day, acharet nityam, delays aging, reduces shrama, and reduces and does not cause any related of vata dosha, this to vata dosha. And next is dushti prasadaha pushyayuhu swapnastu vagdadyat krit. So a person will have improvement, improve of drushti, he'll have pushti, and there will be increase of ayu. A person will have good swapna, good sleep, and also there is proper nourishment and strengthening of the body. Compactness of the body increases. Also, Shira Shravana Padeshu Tam Visheshena Shilayet. A person should take care extra to do Shira, that is head, neck, and the ears, and leg, both the feet. Okay. So, Padabhyanga, that is massage for the foot is very important, because Padabhyanga helps in removing the dryness and roughness of the feet, and also it improves the provides the stability, improves the blood circulation, also reduces various diseases like sciatica or cracks in the foot, and also improves the sleep. So Padabhyanga is very important, and also Shirobhyanga head massage is equally important in bringing down um, the grayness or balding of the head, and nourishes the scalp, and also it strengthens the hair roots, and one also gets good sleep after massage. Next one is the Udvartana. Udvartana is nothing but applying or putting pressure or without oil. That is uh, Garshana. You vigorously rub over the body is Udvartana. Mainly Udvartanam Kavaharam Medasa Pravilayanam Sthirikaranamangana Tvakprasadakaram Param. So this is the shloka of Udvartana, where he says it brings about the Sthirikarana. It brings about strengthening the body, and also decreases the kapha and medas, and also it is very good and clear. It brings about the clear and complexion of the sharira also, and this is done by doing different types of herbal powders which has katutikta rasas, and it also cleans the body as well. Okay, and this little bit of oil is also done, that is also called as utsadana, and the complete with the powder which is done, which dry is udvartana. A little bit of oil when it is done is called utsadana, and by doing this there are blood vessels that gets dilated, and gives lightness to the sharira. Okay, and this type of massage is also called as Utgarshana and Samvahana by Acharya Sushruta. Okay, and next is you have to make sure you have regularly cut your hair, cut your nails, and it should be done. And cutting nails and hair and should be avoided during the menstruation. Okay, and next one is the snana. Snana bath is mainly is snanam shramaharanam. It reduces the shrama, tiredness in the body, and it is also pavitram vrishyam ayushyam shramasvedam alapaham. That is, it brings auspiciousness, and it is vrishya, and it enhances the longevity, and also reduces the shrama in the sharira, and it brings the strength and compactness in the sharira. It improves the ojas in the sharira, and also it removes the sweat impurities, and also the impurities of the sharira. So after massage, after udvartana, if a person is taking bath, then it person will be cured of heaviness in the body, bad odor, drowsiness, or any itching, or any impurities in the sharira. Okay, and also it takes away sleep, it reduces itching, thirst, tiredness in the sharira as well. So there are um, different methods, and also the effects of cold water and hot water, it varies, and in shastras is being told not to pour very hot water on the head first, And hot water should also always use only on the below neck, that is on the body only. And lukewarm or cold water can be used for the head. Okay. And mainly if a person is having any disease related to pitta or rakta pitta, and then cold water is suggested. And other than that, cold water is not advised. Okay. So if a person is taking very hot water bath for the head, it is injurious to the eyes and can aggravate the doshas. Okay. And if a person is having diarrhea, or if a person is having vomiting or loose stools or indigestion, a person is contraindicated to take bath. And also a person after taking food, after consumption of food, one should not take bath. It further if further it causes indigestion in the child. And after taking bath, anulepana, anointments, anulepana is being advised. Anulepana is nothing but you wear nice scented creams or perfumes or sandalwood paste for the sharira. And also for the hair, in olden days the dupa is was used to be given for the hair to smell nice. And also to also can wear garlands or flowers or different type of beautiful cloth, whichever whichever you are more comfortable with, should be worn. Okay. And you also have to wash your feet in the end of the bath. And also avoids washing feet also avoids disease of feet. And also it kills any of the any of the impurities in the leg. And you have to wear a cloth which is very clean, neat, and also which calms your mind, and which brings about positivity in the, it should be worn. And after this, bhojana should be consumed. And bhojana is as in the name of as in a breakfast or in lunch. One should consume with all the rules and regulations which has been told. And one should have appropriate quantity, appropriate quality of food, and also with which is very hot. And you should not speak while eating. And all the rules which has been taken for consumption of food should be followed. And after consumption of food, one should again have should take dhumapana, which is explained before. Before dhumapana, kavala or gandusha should be done, and then should be done. And after washing your hands cleanly, uh, one should you should always touch both of your eyes as soon as you uh, wash your hands. Because while having hot food, there could be increase of doshas in the eyes. So after washing your hands, you tap the same hands, the washed hands, with both of your eyes. And after consumption of bhojana, tambula sevana has to be done. So that is tambula sevana is mainly to bring down the doshas which is being uh, which is being increased while consumption of food, and also to bring about freshness in the mouth. Tambula sevana is being told. Then in Tambula sevana, there are only particular dravyas have been told, that is, and only two leaves have been told, a pinch of lime, and along with karpura, lavanga, and dravyas, sugandha dravyas have been told for tambula. So after tambula sevana, and one should start, one if take a protective measures if a person is going outside of the house. So once a person is going outside of the house, so a person should wear a fragrant dravyas, and also should wear bhada, you have to do the bhadata dharana, that is wearing footwear. Okay, wearing footwear is good for your eyes, skin, and also destroys all the diseases of the foot, and it enhances the strength and courage in the person. And next one is Dandadharana. Dandadharana is always recommended to, to hold a stick in the hand to ward off any the reptiles or tiger or dog. Or in the olden days, it was very important as they used to walk for a very long um, places to very long period of time. So holding a stick, Dandadharana, is very important, and it also supports the strength, and it also destroys the food. Okay. Next one is the protective kavacha. Any kavacha, that means protecting yourself from sun or rain or cold or any according to the season. You protect yourself, and also wear a head turban or the for to protect the kesha. You wear the cloth to protect the head and keep your hair clean, and also always carry an umbrella. And that is what Chatradharana is being explained. Chatradharana is very important to carry. Uh, and Sushruta Acharya has also explained how a chatra should be. That is, it should have a colorful, it should be colorful. And also, it should be chakshushya to see. It should be pleasant to you, and also to protect yourself. Okay, either in case of rain, wind, or dust, or intense heat of sun, it improves the complexion and provides the good eyesight, and it removes off the inauspiciousness. Okay, and after moving on for the day, what you have to do in the day, we go for the evening and the Ratricharya. So there are certain rules to be followed in the Sandhya Kala, and that is from day to the night, the Sandhya Kala. There are five set of things which are to be not to be followed in the Sandhya Kala. That is, Etani Panchakarmani Sandhyayam Varjayet. So there are five things which you should avoid in the Sandhya Kala. What are those? That is, Aharam, consumption of food should be avoided. Maituna, population should be avoided. Nidram, you should not sleep in the evening, the Sandhya Kala. Then some Patam. You read anything you read that should be avoided in the Sandhya Kala. And Gatimadhu, that you walking, you take a walk in the evening, that Sandhya Kala is being avoided. So what will happen if all of these is done? That is Bhojanan Jayate Vyadi. So if a person is consuming in this Sandhya Kala, the food will lead to diseases. And next one is Maitunat Garbha Vikriti. So if a person is doing Maituna or copulation, then the, there will be deformity in the fetus that is being formed. That is Garbha Vikriti can be seen. Next one is Nidraya Niswata. That is, if a person is sleeping in the evening, in the Sandhya Kala, then it could lead to Niswatata. That is poverty. This it brings inauspiciousness. And next, Patat Ayurhani Gate Bhayam. That is, if a person is reading, then it leads to loss of lifespan or decrease in the lifespan. And if a person is walking, Gater Bhayam, if a person is walking for a very long time or walking in the evening, will lead to fear. That is Bhayam. So these are should be avoided. So when it comes to this Ratichari, you can ask when should we do all this? Then when all of these should be done, right? So he says, the last two praharas of the night can be the hours before the night, or the last two prahara, the last 6 hours can be utilized for studying. Okay, and the next two praharas should be given up for the sleep, the last. So before Brahmi Muhurta, the last two praharas you have to sleep. So before those two praharas, before that you can study. Okay, And if a person doing this, then the activities will have both good health, the mental health and also the physical health. Okay. And as it gets late, as it gets late, the moonlight has the effect on the body, right? So it is very soothing, and it enhances the sexual desires, and it brings down the burning sensation, the pitta. It reduces the pitta in the night time. And also, the meal should be consumed in the first three praharas of the night. And this consumption of food should be taken, the quantity should be less compared to the afternoon. And after food, you have to do kavala, anjana, and dhumapana. And before going to sleep, you have to make sure that your mind is very calm. Okay. As you know, this nidra is one among the uh, basic factor for sustaining life. So ahara, nidra, and brahmacharya are the pillars. So it is very important that ahara, nidra, and brahmacharya is being properly followed. So one before getting sleep, properly should go to bed with a pleasant mind. Okay. And also, for copulation, there are particular times have been given in a day, and also on what type of women and men, the qualities of men and women should be present, and also what kind of food should instantly increase the virility in a person should be done. And certain months have been given for practice of intercourse. That is, during Shishira Ritu, and a person can have as much as with his own will a person can practice. And in Vasanta and Sharad Ritu, it should be done only in 3 days once, and in Varsha and Grishma Ritu it should be done in 15 days once, because of the bala will be reduced in these certain ritus, and it also can increase the shrama and also increase the other dosas in the Shirita. That is advised to be 15 days once. And when it comes to Hemanta and Shishiratu, one should do according to his desires. Okay. And these are the thing which has to be done, which has to be taken care of. And this concludes the dinacharya part, which has to be done. So in the next class, we will understand the practical applicability on all of these, how it is affecting these, the current lifestyle, and also why all of these are important. Okay. If you have any doubts, kindly mail to apmsearch@gmail.com. And thank you. We'll meet you in the next class.